Accra today on the deadly Ebola outbreak in West Africa. Health officials from 11 countries are meeting here in Accra to discuss how to put an end to the crisis. Now, more than 400 people have died in what has now become the worst Ebola outbreak in history. Most of the deaths have been in Guinea, but there are an increasing number of cases in Liberia and Sierra Leone. Health ministers from the three affected countries will join officials from neighboring Ivory Coast, Mali, Guinea-Bissau and Senegal, as well as Uganda, DRC, Gambia and hosts Ghana. Okay, so that meeting is on today, and on Tuesday, the WHO said the death toll in West Africa had risen to 467, with 68 of the deaths recorded since 23rd June. The number of cases had risen from 635 on 23rd June to 759, a 20% increase. That's what the WHO is saying. All right, so I'll just speak to Dr. Bedu Sarkodie, who's in charge of surveillance at the Ghana Health Service, to tell us a bit more about this scare and this meeting here in Accra. Good morning, Doc. Thank you for your time.
Yeah, good morning, and to you and all your listeners.
So we're not safe after all.
Yes, indeed. The outbreak started. Initially, cases were coming up one and after the other. Now you're having more cases. The statistics that you gave was correct. That is from the WHO website. And the increase in number of cases, increase of number of deaths, and then the geographic spread is getting a bit wider. Initially, the confirmation of cases at Sierra Leone and Liberia were questionable. Now there are definite confirmed cases at these areas. So it's very prudent that we step up all the various activities and, like you rightly said, not to create panic, but then it's not over. So as much as possible, all that you need to do to contain the situation, prevent against and further spread, we should do everything possible to prevent that.
So how's the monitoring going?
In country, yes, very definite. Very highly enhanced surveillance taxing country at the various points of entry or the borders, also at all the various districts. We have influenza-like illness, influenza sentinel, influenza surveillance all over, and that is what we are using to pick the suspected viral hemorrhagic fevers. Lucky for Ghana, the cases that you suspected and tested at the lab were all negative. But then that does to say that the problem is over, and as much as possible, the preparation to detect, report, and respond to the situation have to be of maximum.
Dr. Sarkodie, I was monitoring a BBC report today, and the information was the reason that the disease is spreading in some of our neighboring countries is because people do not report to the hospital. At least their family members do not take them to the hospital when they start falling ill. Do we have fears of the same thing in Ghana?
Yes, indeed. You see, an outbreak, if it is to a condition that spreads from person to person, if it starts and you wait till so long or so late that within the family setting you might have infected each other before the initial focus is sent to the hospital, that is very unfortunate. So early reporting is very crucial, and that is why earlier we initiated this intensive public education about the signs and symptoms, that when we see this, quickly, let's take the person to hospital, let's investigate whatever it is. If it's that Ebola or any other viral hemorrhagic fever, then we don't spread it among ourselves before we take the person to the hospital. So early reporting is very important, and it's for everybody to know that, so that even when issues start, we don't spread it among ourselves before we report. At that time, it takes about maximum of about 21 days before the signs and symptoms start. And after the initial infection, you are infected. The person infected is also infective and can spread to others. So if you should wait for the clear signs and symptoms of bleeding starts, that time you would have infected a lot of other people.
Okay, so let's get back to the meeting today. What does it hope to achieve? What do we want at the end of this meeting?
Yes, indeed. The meeting is bringing together the health ministers of all the ECOWAS countries, including those affected, those neighboring countries, and the other countries that are not even affected. Ghana, we don't have a case yet, but this is the place that we are holding the meeting. So the idea is to bring together the people with authority that can influence resource mobilization, that can influence maximum response task all over the sub-region and beyond, apart from the ministers of health of those ECOWAS countries. The WHO country representatives of all the West African countries will be at the meeting. One of the assistant Director General, WHO Geneva headquarters, will be present, and then other stakeholders and development partners will all be present. So we have to, the brainstorming session, what is required to be inputted maximally to arrest the situation to prevent further spread. So that's the main objective, to get commitment of everybody, the countries, the development partners, and other stakeholders who matter in the response of this outbreak, and how do we maximally bring together our efforts to arrest the situation.
Okay, so is this a one-day meeting?
Today, tomorrow, and Friday. Today and tomorrow will be the technical sessions, and on Friday, the Honorable Ministers of Health of the ECOWAS countries would come out with, they will meet in-house and then come out definitely what have been discussed, what everybody is going back home, a take-home message to implement.
Okay. All right, Dr. Bedu Sarkodie, I want to say thank you so much for your time. He's in charge of disease surveillance at the Ghana Health Service, joining me this morning with an update and insights on the World Health Organization hosting an emergency meeting here in our country. And you just heard it's a 3-day meeting here in Ghana on the deadly Ebola outbreak in West Africa. And just to say that the WHO has sent dozens of experts to West Africa in recent months to try and contain the outbreak, but we know that it's still spreading. More than 400 people, we're told, have died in what has now become the worst Ebola outbreak in history. You're on the AM show. When I come back briefly, though, we'll start our conversation with Abu Ramadan and Fred Agbonyo. As matters are rising here in our country, and I'm just told that some of the places that I mentioned earlier, some of the stations that didn't have fuel, at least have fuel now, some of them. And I keep mentioning the Shell filling station down there. Who knows down there? Okay, so it's not too far from 355 Fanofa Street in Kokomlemle. They do have some super now. We thank God, something that we're buying. We're so grateful when we have it. Okay. All right, so it's just some 3 minutes after 7, and you're on the AM show. Our show is brought to you by Mixi Coffee. Why don't I just, pause so that you can go grab a mug of Mixi Coffee and join in the conversation. But I will encourage you, if you have comments, you can post them at facebook.com/Joy News on TV. Just to run by you some of the things that we've posted on Facebook and encourage you to go there. Senior citizens in the Upper West region have sharply criticized the Savannah Accelerated Development Authority's tree planting and guinea farm projects, asserting that they should rather be given food to eat. And 5 persons got injured in an accident that involved an articulated truck and 5 other vehicles on Tuesday at the Suame roundabout in Kumasi. A taxi driver was trapped in one of the accident vehicles for close to 2 hours before rescuers were able to remove him from the wreckage. And effective today, 2nd July 2014, subscribers of the National Health Insurance Scheme who enjoy healthcare services at mission hospitals will be made to pay cash. So get to Facebook and get the conversation going. When I come back, I'll read to you some of your messages. Stay with me here on the AM show.